Next question. A 21-year-old man presents to a physician because of extreme fatigue, palpitations, fever, and weight loss. He developed these symptoms gradually over the past 3 months. His blood pressure is 110/80, heart rate 109, respiratory rate is 17, and temperature is 38.1. The patient is emaciated and pale. There is conjunctival hemorrhages, several bruises over the inner cubital area bilaterally. There are also a few lesions on the foot. The cardiac examination reveals a holosystolic murmur, best heard at the fourth intercostal space at the left sternal angle. 2 blood cultures, grew Staph aureus, echo showed a tricuspid valve aneurysm. Which of the following would most likely be revealed in a detailed history from this patient? Question on infective endocarditis. Okay, and this was the answer here was chronic IV drug use. Why that was the answer? How do we know that that was a possible risk factor? Is because they gave us this clue that we have a tricuspid regurgitation. So anytime there's tricuspid regurgitation, there's right-sided involvement, and IV drug use is the most common risk factor for that. So it's the same explanation here, nothing new happening here. You just need to know the minor major criteria. So let's just go over this bit of this. Both physical examination, which is the holosystolic murmur, best heard at the fourth intercostal space, left sternal edge, which is the location for the tricuspid valve auscultation, and USG demonstrate the involvement of the tricuspid valve, which is strongly associated with IV drug use in patients without a septal defect. So IV drug use implies injections performed without using aseptic techniques, so the risk of bacterial infection is significantly increased, and bacteria migrate through the superficial upper extremity veins into the axillary vein or the subclavian vein. Basically, they make their way to the right side of the heart, and the tricuspid valve becomes the site of colonization and vegetation. The most causative organism for IV drug users is Staph aureus, because Staph aureus is part of the skin microbiota in many people and can enter the bloodstream following skin and vessel penetration with a needle. So pretty straightforward but extremely high yield questions on infective endocarditis. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.